Warning that there are some images of a dead boy in a body bag and people in distress that you may find disturbing.
They just managed to resuscitate a patient who's crashed. COVID is tearing through India and every hospital ward, and they're still not winning the fight to get on top of this enormous surge.
He has collapsed and we have revived him, and now we are managing him.
They're low on medicines, they're low on staff, and they're low on oxygen.
Put that SOS, okay? They're sending it, okay? On the SOS number that 400, just lock it saying that we are desperately in need in less than 1 hour and our pressures are dropping.
Dr. Sumit Ray spends the entire time we're with him in the intensive care unit, caring for his dangerously ill patients, whilst also ringing round for oxygen. And right now, levels are perilously low.
It's a constant struggle. Till last night, 2:30 at night, I was struggling for oxygen. And again, from morning.
They're doing what they can, but sometimes it's just not enough. This man is one of the many who didn't make it. They're told international aid is arriving. The government insists it's sorting. But on the ground, the situation is just as dire.
The problem for this hospital and so many others in the capital and across India is that this crisis does not seem to be abating just yet. In fact, if anything, it's getting worse because the health workers, the doctors and nurses are getting more and more ground down and still scrambling from hour to hour to try to get oxygen for their patients.
It is not about being let down. It is a collapse. You know, we do not have time to feel sorry for somebody else. We are losing patients here. And it is not a hidden factor. It is there. Everybody knows it. The government knows it. The administration knows it. Everybody knows it.
The ICU is so crowded, the doctors and nurses barely have room to move between beds. The only way to get into this unit is if a patient dies. Outside the hospital, there are vehicles banked up in front of the emergency department, with people inside struggling to breathe, waiting to get a bed, to get help. Many are in a terribly weak state by the time they get here, and have often travelled around several hospitals before one will accept them. In the emergency room itself, every space is taken. They're pushed up in corners and receiving treatment seated in the waiting area. Nishant rushed his father in here the day before, and now their friends are busy scouring Delhi to buy oxygen.
Hospital might run out any time. They don't have any basic support of oxygen. They might run out in few hours, and there are patients holding here. Yesterday, the emergency ward was closed for no more patient because it was full. This was also full, and bed is also full.
Finally, Dr. Sumit Ray gets the news he's been waiting for.
The oxygen has just reached.
It's a huge relief after working the phones for most of the night and most of the day.
How many more minutes have you got left?
I think we had 20-25 minutes. I don't know, actually. We don't know. We could have shut down any time, to tell you honestly.
The oxygen he's fought so hard for arrives with a police guard. He's bought his patients a few hours, but that's all. India's COVID crisis is like being hit by a massive earthquake, he argues, and the country needs a significant government and worldwide response.
If there is any help that we can get from the West or from any other countries, is not just oxygen. It is like any major disaster. What happens in a major disaster, an earthquake? Teams of doctors, nurses, hospital beds come in and they build up a hospital from scratch quickly, like a major. So that is what has to happen.
There are some signs the virus may be levelling off in Delhi, but with hospitals so overwhelmed still, the capital and India are not out of the coronavirus catastrophe yet. Alex Crawford, Sky News, Delhi.